All about pathological narcissism. Pathological narcissism is a personality disorder characterized by an excessive sense of self-admiration and grandiosity. People with this disorder are usually very self-sufficient and tend to believe that others should submit to their needs and desires. There are several characteristics that can be associated with pathological narcissism, including egocentrism, a tendency to seek the approval of others, an inability to empathize, and difficulty maintaining meaningful relationships. Many people with this disorder have a distorted self-image, which often leads them to become dependent on attention and approval from others. Pathological narcissism can have significant consequences both clinically and forensically. Clinically, the disorder can affect a person's ability to maintain healthy and satisfying relationships, and can also lead to a range of mental health problems. Some of the conditions that can be associated with pathological narcissism include depression, anxiety, substance dependence, eating disorders, and many others. Forensically, pathological narcissism can affect a person's ability to respect social and legal norms. People with this disorder may have trouble maintaining healthy relationships and may have a tendency toward manipulation, lying, and violence. This can have significant consequences in various contexts, including the legal one. For victims of pathological narcissists, it can be difficult to recognize the disorder and take measures to protect themselves. However, there are strategies that can be useful in protecting oneself from pathological narcissists. For example, it is important to maintain some distance and not become too emotionally involved. Additionally, it is important to recognize the signs of the disorder, such as an inability to accept criticism and a tendency toward manipulation. Pathological narcissism is treatable, but requires long-term work on the part of the affected person. Cognitive behavioral therapy and psychodynamic therapy are some of the most common therapeutic options for treating pathological narcissism. It is also important for people with this disorder to seek the support of a qualified professional and engage in a self-improvement program to overcome their disorder. The interesting aspect of pathological narcissism is that often people affected by this disorder do not seek help on their own, as they see nothing wrong with their behavior. In many cases, it is necessary for friends, family, or professionals to intervene to help the person recognize the problem and seek appropriate treatment. It is important to emphasize that pathological narcissism is not the same as self-confidence or healthy self-esteem. We all need a certain amount of self-confidence to face life's challenges, but pathological narcissism goes beyond this normal dose of self-esteem. People with this disorder have an excessive preoccupation with themselves and often seek attention and approval from others in ways that can be harmful to themselves and others. There are several potential causes of pathological narcissism. Some studies have suggested that the family environment may play a role, particularly if parents were particularly critical or hypercritical of the child. Additionally, childhood abuse or trauma can also increase the risk of developing the disorder. Some experts have also suggested that excessive use of social media can contribute to the growth of pathological narcissism. Treating pathological narcissism can be difficult, as people with this disorder often see nothing wrong with their behavior and may be reluctant to seek help. However, there are some therapeutic options available. Cognitive behavioral therapy can help reduce harmful behaviors and develop new ways of interacting with others. Psychodynamic therapy can help people explore the reasons behind their behavior and develop a healthier sense of self. Additionally, some people with pathological narcissism may benefit from group therapy or participation in recovery programs. It is important to note that treating pathological narcissism requires a long-term commitment and that results will not be immediate.